Do you suffer from lower back pain? Have you suffered from lower back pain for more than 3 months? If yes, then you are suffering from chronic lower back pain and you will want to stick around. There are 2 main types of lower back pain: acute lower back pain and chronic lower back pain. Acute lower back pain is simply lower back pain that has lasted less than 3 months. Lower back pain that has lasted for 3 months or more is chronic lower back pain. Drugs, surgery, or a mixture of both is the most common treatment for chronic lower back pain. Drugs only cover up the symptoms. They do not treat the root cause of the pain and can cause other serious conditions from prolonged use. Some of the potential side effects include seizures, blurred vision and vomiting. Surgery also has its complications. Pneumonia, sexual dysfunction and blood clots are some of the potential side effects from lower back pain surgery. In the next 4 minutes, I will share with you the 3 most common chronic lower back pain conditions, going into the science behind these conditions. The lower back is specifically defined as the region between the pelvis and the rib cage. The lower back is separated into 5 main regions, shaded in red in the image to my right. These regions are the lumbar vertebrae, plural for lumbar vertebra, a series of small bones composing the spinal column. The vertebrae are separated by 5 discs, each of the unshaded regions, between the shaded regions in the image to my right. The discs are the most common cause of chronic lower back pain. Now, you might have heard of herniated discs, and you might think that this is what I'm referring to. However, disc pain is not the same thing as a herniated disc. A herniated disc is a crack in the outer layer of the cartilage of a disc that commonly irritates the nerves in the legs. Pain that comes from a disc is caused from a tear inside of a disc. Basically, the disc is like a jelly donut. The jelly that I'm referring to are all of the inflammatory proteins inside of the disc. The reason why these proteins are classified as inflammatory is because when they are too close to the nerves, they can cause pain, numbness, and weakness. The pain worsens when these inflammatory proteins intersect the nerve fibers located in the outer 2/3 of the crust of the disc. Now, do keep in mind it is possible to have a disc tear and a herniated disc. The pain from a disc tear worsens when individuals sit and bend forward due to the fact that these motions put more mechanical pressure on the disc. Also, a tear in the disc does not always cause pain, but can lead to degenerative disc disease, which is painful. Pain from a disc tear accounts for 40% of chronic lower back pain cases in individuals under the age of 40, but is a much more common cause of chronic lower back pain in individuals over the age of 60 due to the deterioration of the body. The facet joints are synovial joints. Other types of synovial joints include knees, shoulders, hips, and fingers, so they all have the same basic parts. They are just buried within the spine, so you can't see them without an X-ray. These joints can become painful and even arthritic, just like a shoulder, hip, knee, or finger. Facet joints are more painful when you stand, twist, or extend your back. They feel better when you are sitting down. This type of chronic lower back pain accounts for about 40% of chronic lower back pain cases in individuals 65 and older, and about 15% of cases in younger individuals. The 3rd most common cause of chronic lower back pain are the sacroiliac joints. These joints are located in both ilium bones, which are located alongside the sacrum. This pain is felt in the lower portion of the back, mostly in the buttocks. This pain accounts for 10 to 15% of chronic lower back pain cases. Some experts have argued that this percentage is as high as 20%. These 3 most common causes of chronic lower back pain account for 80% of all chronic lower back pain cases. In the next video, I will share with you how to treat your chronic lower back pain without drugs or risky surgery. Click the button below to watch the next video.